This program is brought to you by the Travertine Spa Collection. When you need a wellness break from the stress of your day, the natural and organic products from Travertine can help you to treat yourself well. Celebrities adore them, spa professionals trust them. They will surely make a fan out of you too.
My life is on the line. I don't know where to turn. I don't know what to ask. I don't know what doctors to go to. I don't know how to research this online. I don't know if my insurance covers this. I'm here in San Francisco. Mom and dad's in Boston or Phoenix or somewhere else. Is mom getting the right meds? Is she getting good care?
Welcome to another episode of How I Changed Careers, asking why not do your own thing. Have you ever had to deal with confusing insurance procedures, choosing a doctor? What options do you have? Determining which procedure is best? Are you left with going online to research on WebMD? Do you even research a doctor or the procedures that you have? Today we're talking with David Fraiberg, who brings an entrepreneurial solution to navigate your healthcare maze. It's a new form of healthcare services that aims to bring harmony to your healthcare journey. David, welcome.
Thank you.
Thank you very much. Partners. He was also the COO at Parkway 360, a company that he helped to found. Founder and president of Guanxi & Company. Mm-hmm. He was director of worldwide organizational effectiveness at Pfizer, including working at Booz Allen and CSC. But wait, there's more. His education, he has either degrees or certificates or has spent time at Harvard Business School, George Washington University, University of Pittsburgh, UPenn Wharton, MIT, United Nations University, and Stanford. Start off by telling us where this came from and your personal story.
Sure. My dad, who's down in Florida, was diagnosed with cancer, and he was feeling overwhelmed and alone and uncertain. And so, in summary, I basically packed my suitcase and kissed my wife goodbye, and I went down and moved in and helped him find his doctors and went with him to doctor visits and took notes and asked questions. And I will tell you that there's very personal, specific moments that jump out there. I remember once we were in the car, we were coming back from one of the oncologists, by the way, because it's always a team of doctors.
Okay.
It's never just one doctor.
Yeah.
And as you may know, I don't know, with your own health experience, the doctors don't always play nice in the sandbox together. They don't always share information. Yeah. So we were coming back from one of the doctors, and I was driving, and he looked at me and he said, I didn't hear a word that anybody just said in that doctor visit. Uh-huh. I don't know what the doctor just said. I don't know what you said. All I was thinking was, I'm going to die. We were actually refer to this as this kind of Darwinian evolutionary cycle that people experience when they begin having to navigate the healthcare process. Mm-hmm. As soon as you actually are kind of diagnosed or you begin to experience your own mortality in a very real way, that truly incapacitates your ability to negotiate this process on your own. And then you think the second step usually is, well, I've got family and friends.
Yeah.
And they're very capable and they love me and they care about me. They've got my back. And they do. Only what we find oftentimes is that family and friends don't always live nearby and they're not always experts. You do have your doctors, but doctors only treat you for your kind of physical diagnosis and treatment.
Yeah.
I don't think your doctor is going to be on the phone facilitating claims or resolving billing errors.
I don't think so.
So that's where Concerto steps in, basically. Okay. We help you to navigate the healthcare process. That's all we do, navigate healthcare. And we help you to deal with we kind of refer to them as the four horsemen of healthcare. So you have costs, care, insurance, and then error and infection.
Can you talk about why it's difficult to be your own healthcare advocate?
There's a client of ours who calls it the nuanced dance that we do with the doctor. Uh-huh. Is the doctor really telling me everything he knows? Am I asking the right questions? If I go on WebMD and spend 15 minutes or 20 minutes doing research, and I begin to ask him questions, is the doctor going to be offended because I'm kind of playing doctor? Yeah. Only in this case, it's life or death. So it's you get a little bit more on the line.
So if someone was to call Concerto, what practically happens?
Okay, so we pair you with a team of 3 people. So the first one is a case manager, kind of AKA patient advocate. Our term for it is health guard, but case manager.
Okay.
And then the second role is a medical librarian, and the third is an insurance advocate. Mm-hmm. and they work as a dedicated team. They've got your back. They're at your side. And the case manager is your point of contact. They're your really the kind of go-to person.
Okay.
How do they do that? They help you to find the best doctors.
Okay.
They'll meet with you before you go to the doctor visit and help you to, like, how do you talk so your doctor listens?
Okay.
What questions are you supposed to ask? Yeah, and so in fact they'll actually attend your doctor visits with you.
Okay.
So they'll take notes. They'll be listening when it's hard for you to listen because again can be a little bit overwhelming. They know medical jargon. Oftentimes doctors speak in doctor speak or medical speak. They'll follow up with questions and can be bedside. So to really help you avoid error and infection.
Okay.
Did you wash your hands? Is that a clean catheter? Terry, the statistics about error and infection, they're really upsetting. I'll just put it that way. We had just a kind of a friend of Concerto write a letter that's in the blog right now, one of our postings. And in her kind of sharing her personal story, talks about how her sister, the nurse, literally stood in the doorway and blocked anybody from coming in to their father's room in the hospital by checking, what are you going to be doing? What tests are you doing? Why are you doing that? And as you would expect, oftentimes there were tests they were just doing. They weren't clear about what they were doing. They were kind of unnecessary, poking and prodding. And there's no ill will. Nobody's trying to do it. But it's just there's a process there that isn't always working with the patient's comfort and interest in mind. And you want to have somebody by your side. So that's the case manager. The medical librarian, very quickly, helps you to make informed treatment decisions. And the third is the insurance advocate, who helps you to maximize insurance and manage your costs. There's a huge and growing percentage of our clients who are not the actual patient. They're the one of the kids, adult children. They're the one who usually steps up. There's usually one kid out of the children. There's usually one. Well, I mean, look, even Concerto. I mean, that's where where this comes from. Literally, my experience with my dad, helping him through, and then kind of getting good at it, figuring it out, and then family and friends began asking questions, and that became a business. I mean, I don't mean to put it so simplistically, but that's true. And there's a real need out there.
What kind of confidentiality, respect of my information do I have with your team?
We couldn't be in business unless we acted with the word and spirit and deed of HIPAA.
Yeah. So what is the cost structure?
It's basically you pay a membership fee in order to get access to these teams and all these range of services. And then it's just kind of the amount of time on a monthly basis after that.
So what I'm trying to get at is I don't necessarily need you to reveal your numbers because I don't know if your teams want that. What I'm looking for is so that people say, okay, I'm interested in this, but is this going to cost me like $5,000 a month, $10,000 a month? If I only have this much, can I do it? Can I limit what I spend? Can I manage that? Or do I have to have a trust fund to even begin talking to you guys?
Okay, I'm glad you're kind of probing further. Yeah. No, you don't need a trust fund. So yeah, ours is a service that really is affordable to everyone. That's the real thing, man. Seriously, I am on a mission, and the people on this team, every one of them has, whether it's a friend or a parent or a spouse or what have you, everyone has intimately and directly been through this, been through the ringer with this process, and come out on the other side shaking their head going, wow.
Okay, and how is your dad today?
Thank you for asking. I will tell you that I won't say that he was misdiagnosed, but I will say that what they originally said was not what he was treated with, and he's fine. Thank you for asking.
Great. So tell us how people can contact you, whether it's your website, email, Facebook, Twitter. What's your digital signature, and how can people learn more?
So 1-800-298-5113. 1-800-298-5113.
I'll have to do this. I'll call here.
There you go. Call us here. And I feel like I should go back to the ShamWow thing now. But no, quite seriously, go to our website. So it's concertohealthpartners.com.
Well, David Fraiberg, CEO of Concerto Health Partners, thank you for joining us today.
Okay.
All right. Bye-bye.
Terry, thanks so much.